Hi guys, hola, welcome to my YouTube channel. This video is going to be on Saline Ultrasound and HSG. I had my Saline Ultrasound and my second HSG this past week, and I had my first HSG about a year ago in May. So I'm going to tell you about my HSG before I go into the Saline ultrasound, because that was the first one that I did. So my first HSG was done with the VA, and we had to go to the VA and have this done by the doctor there, who is also considered their fertility doctor. She's not actually a fertility specialist, she's just a doctor that they use to get you into the fertility side of things if you're having problems. So let's get right into this HSG. So this was my first HSG I had ever had done. So I looked up a lot of things on YouTube. I read a lot of reviews. I looked up what an HSG itself is. And I had seen that there was a lot of people saying that it was pretty painful for them, and for some people it was a breeze. So I decided that I would go in without any pain meds. I was a little bit nervous, and it was pretty painful for me. So for the HSG test, they have you in an x-ray room, and they put you on the x-ray table, and they get you all set up like you're going to do a pap smear, but you're not actually going to do a pap smear. They just have you set up like you're going to do one in the x-ray room. They insert the speculum, they clean your cervix, they insert a catheter with a balloon attached into your cervix, and they blow a balloon up that's about the size of a dime. And a lot of people that I had seen their videos talked about their HSG test, and explaining it. They didn't actually say that there was a balloon attached or anything, but there is a balloon attached to the catheter, and they blow it up, and it is about the size of a dime. And for me, this first HSG was painful, very painful, because the balloon blowing up in your cervix expands your cervix, and I've never had so much pain in my entire life. Like, it was so painful. On a scale of 1 to 10, it was a 12 for me. A lot of people say they have no pain with it whatsoever, but I had a lot of pain. So they did the HSG test, they push dye through, and they check your tubes, and they make sure that your tubes are clear, that there's no blockages or, you know, any holes in your tube, to make sure that, you know, you have proper movement for the egg to pass through. And that one came out clear, everything was fine. And then I found out that I was pregnant about a month after I did that test. A lot of people say they get pregnant after they have the HSG test. They don't know what it is. Sometimes it actually clears your tubes out, because the pressure of the dye pushing through your tubes clears them out and opens them enough for you to be able to get pregnant. And I guess that's what happened with us, except for it didn't clear them out enough, so we had to have surgery to get my tube removed, because our baby lodged itself in the tube. So that was my first HSG test that I had done. The next test that I had done was a year later. Like I said, a couple of weeks ago, I had a Saline Ultrasound, and the Saline Ultrasound was not as bad as the HSG, still a little bit painful, but not extremely painful like the first HSG test that I had done. The saline ultrasound, on a scale of 1 to 10, maybe a 1.5. A little bit of cramping. They do the similar to doing the HSG, except for it's not in an x-ray room. Most of the time it's in the doctor's office, and they do the ultrasound, have it all set up and everything for you. With the saline ultrasound, again, it's similar. They do still have a small balloon on the end of the catheter, but they don't blow it up as big as they do with the HSG test. The balloon kind of creates a barrier so that the liquid doesn't spill out too fast when they're checking it. So that was the painful part for me in that circumstance, was them putting the catheter in and the small balloon being blown up a little bit. That test went well as well. The saline test that they did with Red Rock Fertility is to check for fibroids or polyps in your uterine lining, and fibroids or polyps will obstruct your implantation, and they want a clear lining so that your implantation goes well. If they do find polyps or fibroids, what they tend to do is they give you a set date where they're going to bring you in and have them removed. Luckily for me, I didn't have to do that. But that was my saline ultrasound. It was really quite easy. It wasn't as bad. There was still a little bit of pain. I know some people might have had a little more pain than a 1 or a 2. Might have been about a 3, but it's a lot shorter than the HSG test. Now, I had a second HSG test after my saline ultrasound. Let's see, about 4 days after I had my saline ultrasound, I had the HSG test done with Red Rock Fertility. They sent me to Steinberg Diagnostics to have that done, and they were great there. The staff was amazing. The doctor who did the HSG was really nice, really gentle. He was a male doctor, but since he does work with Red Rock Fertility, he gets a lot of females coming in for HSG tests, and he's very gentle and very considerate of the pain that you're going to go through with an HSG. Now, this time around, I have learned from the first HSG that it's going to be really painful for me because my uterus is tilted. And that's what they asked me at the doctor's office for this Steinberg Diagnostic HSG test. They had asked me if my uterus was tilted, and I also let them know that I only had 1 tube left from my ectopic pregnancy. And with them asking if your uterus is tilted, that actually affects the pain level that you're going to have with an HSG test. A lot of times, if your uterus is tilted a certain way, the catheter going in will hurt a lot more than anything else, and also the balloon blowing up will be a lot more painful. But like I said, I learned from my last time that it was painful, and I opted to take medication before I went in, and I had some leftover medication from when I had my surgery from the ectopic pregnancy, and that helped immensely. This time around, the doctor did it a little bit different. The first HSG test, she didn't ask me to move side to side. She didn't ask me to move from one end of the table to the next. She was prepped on one side, and she pushed me up to the front and made sure I did everything right there because I was in so much pain. With this HSG test at Steinberg Diagnostic, they actually have you be at the end of the table when they put everything in, and then they move you from the end to the middle of the table where the x-ray goes over your pelvis. And I thought it was going to be a lot more painful because of the last time I had it done, but my medication had kicked in and I didn't feel any pain at all. I felt maybe a tiny little nudge of something when I was there, but not too much. When the doctor was doing the procedure, he was letting me know what he was doing and when it was going to happen. So he was letting me know he was putting the speculum in. He cleaned my cervix 3 times, and then he told me he was putting the catheter in. He did not let me know that the balloon was being blown up, but he did let me know that the catheter was in when it was in, and then he started to blow the balloon up. And because of my tilted uterus, he was a little more considerate not to blow up the balloon extremely fast. And that went well. He had me tilt from side to side to see the liquid spilling out of the one tube, and he told me that everything looked good. He took everything out. He showed me the HSG test and the images from it. He showed me that my one tube that I have left looks great. It's open. It shouldn't be a problem anymore, and that we should be able to get pregnant with IUI. So that is my experience with the Saline Ultrasound and the HSG test. Like I said, the first time I had an HSG test done, extremely painful, but I apparently was a very good sport about it, and it went well. The Saline Ultrasound wasn't as bad as the HSG test. Still a little bit of pain. I would recommend taking a little bit of medication for pain if you're going to do the saline, but you don't have to if you don't want to. It's not like required because it's extremely painful. Just for me, it was painful in general because my cervix and my uterus being tilted in a certain position to where it's a little bit harder for them to get the catheter put in. But other than that, that's it. You know, my Saline Ultrasound was good, my HSG was good. When we go to Red Rock Fertility in the next couple of days, we'll get our game plan from Dr. Eva Littman at Red Rock Fertility and what she thinks that we should do and where we're at in terms of what needs to be done and medication that I need to be put on. But that's all I've got for you guys today. I'll see you guys later. Hasta luego.